Hi, this is Dr. Bean with Atlanta Mobile Aesthetics and Hydrotherapy. Today I wanted to talk to you about the newest medication that seems to be circulating for weight loss called Semaglutide or Ozempic. This medication has been shown in multiple studies to help with reducing weight loss over a time period if administered properly. So let's talk about this medication today, what to expect from its use, how to prepare for its use, and the results that have been shown. So, semaglutide or Ozempic is a medication that is used to help treat diabetes type 2 traditionally. The way this medication works is that it causes the pancreas to ultimately stimulate insulin release in the body. As you all may know, insulin is used to treat diabetes. Therefore, the increase in insulin that is released by the pancreas as a result of using this medication has a secondary effect on how the stomach then processes food. Essentially, what it does is to allow the stomach to slowly break down food and slowly process food at a rate that is continuous but decreased from what's normal. This tells the brain, hey, I'm fuller much longer, and thus leads to a suppression of appetite. So, with the suppression of appetite, due to the decrease in how the stomach empties out on a regular basis, this subsequently leads to secondary benefit of weight reduction. When clients have the benefit of processing food slower over time and the increase in the insulin that is built up in the system that is released from the pancreas as a result of utilizing this medication, clients also have a secondary benefit of increased energy and they feel better overall. Now, how should this medication be administered, and what is the proper way to ensure that if you are receiving this medication, you are getting it in the recommended doses based off of the clinical trials that were done? The way that this medication should be started is at a very low dose, and over a series of 16 weeks, the dose should be titrated up or increased by a healthcare professional every 4 weeks to a maximum dose. It is important to go through this process in a stepwise approach to help to hopefully offset any side effects that may occur during the process of receiving this treatment. So, what are some of the side effects that could happen as a result of receiving this medication? Some include GI upset that represents itself as diarrhea. You can feel very sluggish or tired at times. Of course, decrease in appetite, which happens during the course of receiving this medication. You can have a drop in your blood sugar as well as the dose increases. Some clients may find themselves not remembering to eat, which can lead to what happens when a diabetic fails to eat and their sugar drops after receiving insulin. They get very tired, they get lethargic, they get extremely weak. And if it gets severe, they're unable to perform certain bodily functions or function at all. So it's really important to understand what the side effects of this medication could be, and that eating and remembering to eat while taking this medication becomes key to offsetting some of these more significant side effects that can happen. Well, how well does this medication work to reduce weight? There have been several trials that have been done, and they demonstrate up to about a 14% or more weight reduction, especially in those with a BMI or a body mass index greater than 30 who are non-diabetics when it was studied. So there could be an impressive weight loss over a significant time frame that the client can experience by utilizing this medication. Now, just like with any other kind of weight loss program or approach, medication is not just one way or should not be the only way that clients use to lose weight. Of course, healthy eating, maintaining a consistent and steady exercise routine, getting plenty of sleep, and proper hydration with water daily. For women, that would be 2 liters daily, ideally, and for men, 3 liters daily. Is ideal, is highly recommended in conjunction with medications such as a semaglutide as you are on your weight loss journey. As always, I recommend that you talk to your provider or injector prior to receiving any new treatments or medications. Ensure that the proper initiation of this medication is done and that it is titrated up over a period of 16 weeks to get you to a maximum dose to help offset any harmful side effects that you could possibly experience while taking this medication. If you are a diabetic, make sure prior to having this medication started that your A1C is up to date and that proper blood work to assess your kidney and liver function is also obtained. This also goes towards people who are non-diabetic as well. Did you find this video helpful? Do you have any questions or comments? If so, leave them below and I'll get back to you and answer all your questions as soon as possible. In the meantime, continue to follow us here for more content, like and subscribe, and thank you for watching.